A global nonprofit organization scales up its commitment to provide high-quality surgeries to cleft lip and cleft palate patients around the world. Over the next 10 years, Operation Smile is on a mission to provide access to care for 1 million patients who need cleft care and other essential surgeries. And to tell us more about this initiative, joining us now live via Zoom is Emiliano Romano. He's the Executive Director of Operation Smile Philippines. Good morning, Emiliano. Thank you for joining us.
Good morning, Paul, and thank you for having me.
It's a real pleasure. Emiliano, first let's talk about the cleft lip and cleft palate situation in the Philippines. How many Filipino kids on the average are usually born with this problem?
All right. As you know, the rate, some of the people knows the rate of cleft in the Philippines, actually the birth rate is 1:500. So if we take a look at 2020, for example, we had a 1.5 live birth, right, in the Philippines per se. So if now we're going to go on a ratio of 1:500, we get at least for that year alone 3,000 children born with cleft. This is not considering children that are not registered. You know, as we know in the Philippines, we are a huge population. When you look at the communities, not everybody actually registered when they have a live birth. So estimate, I would say, in the Philippines alone, we would have around 100,000 to 200,000 backlog of patients with cleft.
So that's quite a number of kids who actually need this help. Operation Smile actually started here in the Philippines way back in 1982, thanks to plastic surgeon Dr. Bill McGee Jr. and his wife Kathy. And this year you guys are celebrating your 40th anniversary. How's the operation here in the Philippines and in other parts of the world? In fact, how many patients have benefited from your programs and medical missions?
That's right. So this year we are, as you mentioned, we are celebrating our 40th anniversary. So far, globally, we have treated a total of 300,000 patients. In the Philippines alone, we were able to at least do 10% of the global number. We are sitting at between 30,000 to 35,000. And of course, with the 40th, we just released a commitment that in the next 10 years, we really would want to provide care to at least 1 million patients worldwide.
Right. And kids really do need this type of help. A cleft lip, a cleft palate does affect so many other things. It affects your nutrition. It leads to malnutrition in some cases. It affects your speech, your learning, esteem issues. Many kids are often bullied. What does it mean for the Philippines that you are going to be on your 10th year and you committed to actually reach more remote areas and far-flung communities?
That's right. So in Operation Smile, in everything we do, we always say that the surgery is actually just 10% of the total program that we do. Actually, what we do is a comprehensive cleft care approach where we do nutrition programs, we do dental, we do speech therapy and surgery. Currently in the Philippines, we have 3 centers, one located in Manila, one in Pampanga, and one in Davao. Our goal is in the next 10 years is to be able to have presence in all 17 regions in the Philippines. While now we only have 3 centers, soon we're working on this year and hopefully early next year to be able to open a very big center in the Visayas region as well.
Well, it really does change the lives of the kids who receive this type of care. In order to make this vision a reality, Emiliano, you're working on transforming and strengthening local health systems. What exactly do you mean by this and what will your focus be?
That's right. So with the commitment of the 1 million patients in the next decade, we really would want to go into the district hospital here in the Philippines to really not just take care of cleft patients, but really to help the health system in the Philippines by investing in district hospital, by providing training, anything that is needed to actually help the entire Philippines health system. In that case, of course, those hospitals can take care of cleft patients, but at the same time, they can take care of any children out there in the Philippines that needs care.
Well, we salute the efforts that you guys make, and really, please do continue to do the work that you do. Thank you so much, Emiliano Romano from Operation Smile Philippines.